Welcome to another episode of the About Mansfield Consumer Advice Series. I am your host, Steve Casillo, and to my right, with our continuing series on vertigo and dizziness, this is Dr. Joe Adams, Dr. Joseph with Calibration, Chiropractic, and Functional Health. Welcome back to About Mansfield.
Excited to be here.
The last time we got together, we talked about some conditions, and we're going to break down some of these conditions. We talked about BPPV, cervicogenic, and hypofunction. And when someone comes into your office and says, you know, I've got dizziness, I've got, how do you break that down to determine what type of dizziness or vertigo that they're suffering from?
Yeah, so that's really important. You have to figure out which one it is, because if you don't know which one it is, you can't really successfully treat it. You know, that's why, diagnosis really matters. And the first thing that, we're going to do is talk to them, figure out, when they're experiencing the dizziness, and look for, cues in the history that indicate that it's one of these types that, we can treat in our office, and make sure it's not one of these types that we need to send them to a neurologist or, potentially even the ER for. And so, one of the first things I'm looking for is when do you get dizzy, right? Is it when you're standing? Is it when you're laying down? Is it when you move your head into certain positions? That's what I'm looking for, or is it just random? And so we can classify patients pretty quickly based off of when they have the dizziness. So if your dizziness is more when you lay down, I'm thinking it's BPPV, most likely. Now, if it's when you're moving your head or neck, regardless of, laying down or being vertical, I'm starting to think maybe it's cervicogenic. It's coming from their neck. And then if it's specific, movements, very specific movements, maybe we're looking at hypofunction, where one side of the vestibular system is not, working. So let's say it's only when they turn to the right, that they get dizzy, right? And regardless of the position. So that's really what we're looking for in the history. And then from the history, we're looking to move into testing. And in the testing component, we're going to put goggles on their eyes and look for eye movements that can give us an indication of what kind of dizziness it is. We can also have them stare at a screen that tests their eye movements, which can also give me an idea of what type of dizziness it is. And then another test that we have is a balance test, because when you're dizzy, your balance is affected. And so we can have them stand on a force plate, which actually measures how much pressure is on their feet.
Right.
And then we can have them move their head and neck into different positions, have them open and close their eyes. And this will give us an idea of where in the brain the dizziness is, where it's coming from the eyes, whether it's coming from the vestibular system, or maybe it's coming from the joints in the neck. And so that's how we classify these patients in office to get to a diagnosis. And then from there, we can start, on the appropriate treatment for that condition.
Could it be something as simple as low blood pressure, which I hear can also cause dizziness?
Yes, it can.
And the sudden standing up and you go, whoa, head rush.
Yep.
Okay, so we're kind of in the same ballpark here?
Yes, we are, yeah.
Okay.
Yep. So that specific one does happen to people who have possibly cardiovascular issues, and that would be more common. People have low blood pressure, right? Because when you have lower blood pressure and you've been sitting for a while, if your heart doesn't receive the signal from the brain to increase your heart rate when you stand up in enough time, then that blood going to your head is not going to make it up there in time as you stand up, and then you're going to feel lightheaded and dizzy.
You're back on the cruise ship again, and you're all right. So now I'm at home. I've been diagnosed. I know what to do, or do I know what to do? What can people do at home to help recover from whether it's vertigo or dizziness?
Yep. So one of the things you do have to realize, what kind do you have, right? So make sure that, if you have an acute episode of dizziness, especially one that's not positional, and if you have any other signs or symptoms, you get seen, by a medical doctor as soon as possible. But once you kind of have an idea that this isn't life-threatening, and maybe you still don't have an answer of what it is, there are some things that you can do to help. And one of those is going to be an exercise. And so if you have BPPV and you know which head position causes the vertigo, you can go on YouTube and find a video of how to do an Epley maneuver on yourself. And you may have some success treating it on your own at home by watching one of these videos and doing the maneuver on yourself.
Yeah.
If you feel comfortable. The only downside to that is you may get really dizzy doing it on yourself. You could get nauseous. You could vomit. It could be scary. It's really stressful. Okay.
Do each of the conditions, again, BPPV, the cervicogenic, do each of those come with their own sets of exercise?
Yeah, they do.
Okay.
Yeah, that's kind of what we're getting at.
All right.
And so, for the BPPV, that's one approach. Now, if you have hypofunction, you just need to know which side is not really firing appropriately and then stimulate that side. So if it's hypofunction, let's say, and it's to the right, you always get dizzy to the right. Well, we kind of got to build that right side up. So, doing, eye and head movements to the right at a certain ratio may improve that or give relief. And then another one for, dizziness could be fixation. So if you get dizzy, and it is a peripheral condition, not a central condition, then fixation will help you. So fixation is just, putting your eyes on a target. You could even use this if you would say you got a little too drunk, you get a little too drunk and you get a little dizzy, you could, work on fixating, and that will relieve that dizziness that you're experiencing. So fixation can help. Another thing that we use with patients when they're experiencing a lot of dizziness is ginger. Ginger's been shown to be very effective at relieving dizziness. It's also been shown to be very effective at improving migraine too, as an abortive or as a maintenance supplement. And so,
where do I buy ginger?
The best place to go get ginger would be powdered ginger over its sprouts in a capsule form. 600 milligrams is typically what we recommend for dizziness or migraine patients.
So I the grocery store, I just buy a ginger root and just take a bite out of it, or
you could do that. Yeah, it'd be hard to measure though.
Yeah, that's true.
Yeah, you can just start eating ginger just the way it is.
I love ginger, but not. Yeah,
not that much.
I'm not going to take a bite of it. So, all right. So, exercise, ginger. You mentioned, or did you mention decreasing triggers?
Yeah. So, you can decrease triggers as well, because anybody who's been dizzy for a long period of time will realize that lack of sleep will make you worse, and high loads of stress will make you worse too. Because the thing about the vestibular system is it's like one of the oldest systems in the brain, and it's hardwired to your emotional centers in the brain as well, like your amygdala. And so you need to decrease stress and you need to get rest is a big one. And then obviously if you're having dizziness issues, you don't want to be drinking beer every night or whiskey or anything like that, because it's going to make it worse because of its effects on the cerebellum. So you definitely want to decrease alcohol and any other triggers that you notice make you worse. And then, back to that cervicogenic condition, if you have, cervicogenic dizziness, then stretching your neck will actually help you. Keeping your neck loose will help you. This one's very common in car accident patients. So somebody who's been in a car accident and, ruptured a disc in their neck, and then, as time has gone by and they've aged, they have more degeneration in their neck, they're going to, at some point, possibly experience cervicogenic dizziness. I see it all the time. I get people come in and they're like, I was in a car accident 4 years ago and I've been pretty good since I was treated for it, but now I'm dizzy and I don't know why. Yeah. And I'm like, oh, it's because your neck was so damaged in the car accident and you've degenerated more. Now your brain has no idea what your neck's doing and you're dizzy. And so, taking care of neck health, keeping it loose, keeping it mobile will improve your cervicogenic dizziness. But you've got to know that that's a cause, because, trying all of the, any and all of these things without knowing, what the cause of your dizziness is will be kind of like, just like, throwing a dart and hoping you get it right, So you need to see somebody who really knows how to treat these things and can help you on the journey to recovery.
In the minute or so we have left, is there a recap that you would like to talk about regarding dizziness and vertigo?
I want to say that, vertigo is, one of the worst things that I've ever seen people experience. I mean, it's terrible.
Yeah.
It's very disorienting. It's very scary. And you need to get it treated, because for some reason, people seem to be out there living with vertigo on a daily, weekly, monthly basis and not really doing a lot for it. And that to me is just sad. It's like heartbreaking.
That some people have maybe they have it, they don't know they have it. It's just something that they've lived with for.
It's like, I think what happens is that they don't see providers that know how to treat it.
Yeah.
Because there's not really a lot of knowledge in the healthcare professions about how to treat this unless you've seen somebody who's, done a lot of education on it. And so I think people just get in the habit of just living with it.
Yeah. If someone wanted to reach out to Dr. Joseph Adams and had more questions about dizziness and vertigo, how do they reach out to you?
Yeah, you can find us at calibrationmansfield.com. Do a search for us on Google, and we're all over social media, and we have a lot of content out there, especially on YouTube about this stuff. We're always happy to sit down and have a conversation with someone and see if we can help them.
CalibrationMansfield.com is the web address. That right there is Dr. Joseph Adams from Calibration Chiropractic and Functional Health. That is another 10-minute nugget of information on the About Mansfield Consumer Advice Series. Dr. Joe, let's do it again real soon.
Let's do it.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.